Hi all, we're back, and I know it's been a long time since I've done a video, but tonight our topic for discussion will be how much do we really remember? We know we run around in the clinical setting and we do things, and there are things that we do forget. Sometimes certain things you remember more than others, and sometimes because you have not seen things for a while, you tend to forget. So I just thought I would bring up a few topics of interest that you might want to do your own little refreshers on. Of course, there are many other videos that you can use. One of the things is I brought up a session 7 on head trauma, and there are a variety of topics that might be of interest to you here. You can see epidural versus subdural hematoma. There are quite a few people who do not even know that much because of not having experienced very much with head trauma. And the golden hour, of course, is also involved. And the golden hour is that very special hour when trauma first happens. What your priority with ACLS, and Dr. Adam Cowley a long time ago described it, the golden hour, but also ACLS, we know we use advanced cardiac life support. Then another topic I wanted to bring to you is enteral and parenteral nutrition, dysphagia, and aspiration pneumonia. These are very important topics because there are many patients in the hospital, or not just hospitals, long-term care like nursing homes and so, and even in the home, who have to be given nutrition by other means other than just eating and drinking. They have lost that ability, sometimes permanently, and they have to be fed through enteral feeding or parenteral nutrition depending on the situation. And there are other things that we have to take into consideration, like aspiration, which can very readily happen, and dysphagia, difficulty swallowing, varying degrees of that one too. Aspiration pneumonia is a very important topic because it can happen quicker than you think. So these are topics I thought I would bring up to you if you just revise them, and that would be sessions 14. Another topic of interest is the liver patient, and I don't really know right up what the sessions it is, but liver failure. I've given you an example of the clinical picture of a patient in liver failure. Some things to remember: they're very jaundiced, they have ascites, which is that enlargement of the abdomen. Then they have their skin very thin and very swollen. They have pedal edema. It is really not a pretty picture. Diminished urinary output. And many of these patients have lots of difficulty breathing. Sometimes they have to have things like a paracentesis done to eliminate some of that extra fluid in the abdomen to make it easier for them to breathe. And so I'm not really sure what sessions it is, but you can just type it in and find out, do the search and find out what sessions it is. And then this is a topic which is rather important, and some people do know about it and have experiences, and some people haven't. I gave you the one on the new nurse ICP monitoring. This is very important because when trauma happens and people have head injuries, ICP monitoring is done. And managing a patient with ICP can be like a balancing act. And there are some simple things to know about it, about the techniques that are used, and how, when you have a patient with ICP monitoring, how you manage them and manage their head to prevent bad headaches and so, and overdraining the ventricles. So I hope I have exposed something to you tonight that can be very helpful. Have a wonderful week. I hope you've learned something from this. Bye.